Good morning, good afternoon, good evening, depending where you are in the world. It's been an intense week with the current crisis continuing to reveal deep-seated injustices and inequalities. I'm James Hines. I'm the chair of IAFFE's membership committee, and I would like to welcome you to today's event, COVID Inequalities in the Global South. It's the fourth event that we've had. We're continuing on with a series of events focusing on the COVID crisis, at least for the next several weeks. Then we'll diversify out some of the topics in formats. And we want to bring IAFFE members on board in terms of organizing future panels. So keep your eyes out for that. I have just two announcements to make before we'll begin today's event. The first one is that our fifth event will happen in 2 weeks on June 19th. It's called COVID in Racialized and Marginalized Communities. The panelists will include Michelle Holder from John Jay College, CUNY, Cruz Bueno from SUNY New Paltz, Amy Bishop from Outright Action International, and Judith LeBlanc from the Native Organizers Alliance. IAFFE board member, Linda Pickborn, will be the moderator for that. It should be a very interesting and important event. So I hope you can all join us for that. That's 2 weeks from today, June 19th at the same time. My second announcement is that normally IAFFE has its membership meeting at the annual conference, but since the annual conference has been postponed until 2021, we are having an online membership meeting for all IAFFE members who are current members in good standing, and that's going to take place on June 24th. The timing for that is 1400 hours Coordinated Universal Time. If you're wondering what Coordinated Universal Time is, that's the new name for Greenwich Mean Time. If you're wondering what time that actually is, it's 1 hour earlier than what it is right now. So that's on June 24th at 1400 hours UCT. That's 1 hour early. If you look at your clock, just 1 hour earlier than whatever time it is right now. Note that this time is a correction from what appeared in the IAFFE newsletter, which said 1500 hours. It's actually 1400 hours. We'll be sending around a correction and make sure that everyone, all IAFFE members, have the right time and all the appropriate logon information for that meeting on June 24th. Okay, that's it from me. I'm going to turn it over now to Naila Kabeer from the London School of Economics, who will introduce our panelists and will moderate today's event. So over to you, Naila.
Thank you, James, and welcome to everyone. Good morning, good afternoon, and good evening, depending on where you are. So this is the fourth of IAFFE's COVID-19 webinar series, and as James has just said, the theme today is Inequalities in the Global South, and we have a very impressive panel of 4 people. I'm going to just introduce them all right now, very brief mention. They're all people with a strong track record of work, so you can find out more about them on Google or wherever you look for your information. But let me just very briefly introduce them and then invite them to speak. So first we have Abena Oduro, who is the director of the Marian Institute for Advanced Studies in Africa at the University of Ghana and is associate professor in the economics department. Then we have Ipek Ilkkaracan, who is a professor of economics at Istanbul Technical University. We also have Magdalena Sepúlveda, who is executive director at the Global Initiative for Economic and Social and Cultural Rights in Mexico City. And last but not least, we have Professor Ashwini Deshpande, Professor of Economics at Ashoka University in Delhi. So I'm not going to waste any more time. I would like the speakers to have as much time as possible and discussion as much time as possible. Each speaker has a maximum of 10 minutes, and I will start waving at them when their time is coming near. So I'd like to invite Abena to start us off.
So greetings to everyone from Accra. And I would first of all like to thank the organizers of this webinar series for inviting me to be a panelist. It is important that we have a perspective from Africa. And I emphasize a perspective from Africa because Ghana is one of over 50 African states. Now, since the first case of COVID-19 was confirmed in Ghana on March the 12th, 2020, the government has responded quite swiftly with a broad range of measures. And I shall in this presentation examine 3 of such policy measures and directives to determine which groups may have benefited and which groups may have been excluded from taking advantage of them. Next slide, please. I would first like to provide a little background. The number of cases has grown quite rapidly since 12 March, when the first 2 cases were confirmed. The death rate is relatively low, and as is the case in many other countries, men are more likely to be infected than women. Next slide, please. Government has introduced several measures in response to the epidemic, and they may be classified into 4 groups. So the first are general measures and directives that affect the entire country, such as the directive prohibiting mass gatherings, including the closure of schools and universities, and measures targeted at the health sector, such as a 3-month tax relief to frontline health workers. Next slide. We also have measures to cushion the impact of the pandemic on households and individuals, such as 3-month subsidies on electricity and water, and measures providing support to businesses such as soft loans to micro, small, and medium enterprises. So I would like to examine the effect of 2 policies to cushion the impact of the pandemic on households and one of the general measures. The next slide, please. So I shall begin by assessing the water subsidy. Government has absorbed the April, May, and June water bills of all households in the country. But to benefit from the subsidy, a household must have a water bill. However, not all households have water bills because some households do not source their water directly from the water company. They source their water from boreholes, public standpipes, rivers, and lakes, or purchase from water tanks. So as we can see from the graph, there is inequality in the use of pipe-borne water. Households in the lowest expenditure quintile have the lowest proportion of either women-headed or men-headed households that source water directly from the water company. And we find that as we move from the lowest to the highest wealth quintile, the proportion of households that have access to pipe-borne water increases. Now, in the absence of information on who in the household pays the water bill, I have tried to glean a gender dimension by disaggregating the data on the source of drinking water by the sex of the household head. And we can see that in the lowest expenditure quintile, women-headed households are more likely than households headed by men to source water from the water company. In the second and third quintiles, we find that there is equal likelihood of households headed by women and men sourcing water from the water company. And we find that the gender gap emerges, and a gender gap against women as we move towards the 4th and the 5th quintiles. So the evidence in the graph suggests that households in the 2 highest quintiles, accounting for 40% of all households, will absorb more than 50% of the water subsidy. The income dimension of inequality in this instance is more acute than the gender inequality. However, we also observe that there's heterogeneity among women-headed households, where women-headed households in the upper 2 quintiles are more likely to benefit from the water subsidy than households headed by women in the lower quintiles. The next slide, please. A similar pattern emerges for the electricity subsidies. Almost all households in the highest quintile use electricity from the national grid to light their homes, whilst only 50% of households in the lowest expenditure quintile do same. The differences in the incidence of use of electricity for lighting between households headed by women and men is not very large. And in the two lowest quintiles, it is higher among women-headed households. Now, if we look to the graph on the right, it shows the distribution by quintile of households that pay electricity bills, because again, you're going to get the subsidy on your electricity bill. Now, of the households that pay electricity bills, 62% are households in the top two expenditure quintiles. So this suggests that these households will receive the greater share of the electricity subsidy. Next slide, please. So finally, we examine the education directives. All schools and tertiary institutions were shut down with the outbreak of the pandemic in Ghana. Now, in response, government provided what it called distance education solutions. So students are expected to keep up with their lessons through programs screened on television, through apps, and online classes and lectures. And government has collaborated with two of the large telecommunication companies to make access to these resources without requiring data. And at the tertiary level, both faculty and students were provided with data. Now, the distance education solution is premised on a number of assumptions: that all households have electricity, all households have televisions, households have a smartphone, a laptop, a desktop, or a tablet, and that there is universal internet connectivity and quality is the same across the country. The next slide, please. Now, these assumptions are unfounded. The distance education solution, though well-intentioned, is nevertheless flawed because of the socioeconomic inequalities that exist in Ghana. Among 12 to 15-year-olds, ownership of smartphones is more widespread among those living in households in the fifth expenditure quintile. And across all quintiles, women and girls are less likely to own smartphones than boys. Now, ownership of desktops, laptops, and tablets are similarly skewed against the poor and against women and girls. And there is spatial inequality in internet connectivity and its quality. I can tell you that it has sometimes been a nightmare holding online lectures because some students reside in residential areas where the internet service leaves a lot to be desired. So the school closure has impacted students differently, depending on where they live, their gender, and their class in terms of income group. Some children have been able to keep up with their lessons, whilst for others, it is impossible. Another adverse effect of the school closure, which I guess is yet to pan out, is the risk of unwanted pregnancy, leading girls to dropping out of school, and the increased risk of child marriage. So in conclusion, the examples provided are illustrative of how subsidies that are not targeted and that are meant to be universal, that is, benefit everyone, exclude some groups, particularly the poor and vulnerable, not because of elite capture, but because of underlying gender, income, and spatial inequalities. And we haven't discussed much, anything really in terms of the spatial inequalities that exist. Now, in the presence of these inequalities, policymakers must give more careful thought to which measures to employ and the design of the intervention if the objective is for all to benefit. The intention of the government of Ghana is to provide relief to all households and to minimize the effect of COVID-19 on the education of students and pupils. Unfortunately, the interventions chosen, that is the electricity and water subsidies and the distance education solution, have not succeeded in achieving these objectives because some vulnerable groups have been left out. Thank you.
Thank you very much, Abena. You were very much to your time. So now I'd like to invite Ipek.
Yes, hello. Thank you for inviting me. Very happy to be part of this IAFFE organized event. I've been following the webinars with a lot of interest. I will be sharing some perspectives from Turkey, and because that's where I'm based, and within the limitations of time, also some from Jordan, because along with the UN Women Country Office there, we produced one of the first country reports on the economic impact assessment of the COVID-19 pandemic on women, which was published already early April. Next slide, please. So Turkey has the 10th highest number of cases in the world, unlike Jordan, which has a very low number of cases. But Turkey, compared to its higher income counterparts in Europe or the USA and some other countries, actually has a much lower death rate. And also at the peak of the epidemic, there were no experiences of shortages of intensive care capacity or ventilators or test kits. So the Turkish case was actually acknowledged as a success story by the World Health Organization and some international authorities. Now, I think there's an interesting political economy context to this seeming success story, where at least for the time being, it seems to be effective. So I'd like to mention that political economy context in the way of an introduction, maybe. The healthcare services was a priority area of investment by political Islamists, along with a number of other things such as public housing and cash transfers. And one of the main factors behind their repeated electoral success since the early 2000s until recently. And this really came against a neoliberal background of the 1980s and 90s, where Turkey underwent stabilization and structural adjustment programs like many other developing economies, where we observed the dismantling of the social welfare state, privatization of social services, increasing income inequalities, and the rising of political Islam in the 2000s actually infiltrated and gained power using these items such as healthcare services as a populist tool, and they infiltrated through what I call the neoliberal cracks. Next slide, please. Okay, so the economic context is not as much of a success story as the healthcare system. In the pre-COVID context, Turkey was already facing, since the past few years, since 2016, a decreasing growth rate, around 2% to 3%, increasing unemployment, and around 14–15%, and increasing inflation. And this was really, this vulnerable and uncertain macroeconomic environment was driven by political and social polarization, repeated elections and the associated populist spending, mismanagement, corruption, and a deteriorating democratic and human rights framework. We were observing massive capital outflows and substantial currency depreciation and declining foreign exchange reserves already before the COVID pandemic started. So as it started, then the Turkish economy and the policymaking was caught off guard, having already depleted some of its precious resources, which a country, an economy badly needs in order to deal with the current shock. With respect to the search for financial, additional financial resources, the international swap demand was refused by the Fed, which has another political economy behind it, with involving tensions between Turkey and the US with, due to relations with Russia. And the government refuses to approach the IMF because there's another political economy issue there. So we don't know. It's, at this point, it's quite uncertain and unclear as to where the international helpline will come from. So despite this, the government announced a fiscal package which corresponds to around 2% of GDP, which some of the recent studies that came out with simulations are arguing are nowhere enough to deal with the type of unemployment and poverty that we are expecting to arise in the coming months. Because of the amount of it, and it basically targeted formal protection of employment and business in the formal sector with some amount of cash transfers to low-income households. Next slide, please. Economic growth is estimated at -5% for 2020. The unemployment estimations are up to 25 to 32%. And the unemployment rate is not a good enough indicator for an economy like Turkey, where structurally the female labor force participation rate and the female employment rate is very low. So when a crisis like this hits, it's very easy for women to really disappear out of the labor market and be unseen in the unemployment statistics. So the employment rate is actually a better indicator maybe to look at, and it's expected, some studies expected to decline from an already low 46% to an even lower 40%. Now, in terms of the gendered labor impact, I think that the most of the discussions and the findings revolve around three headings. First of all, despite the low employment rate, low participation rate of women in the labor market, particularly in Jordan, it's as low as 11–12%. So both for Turkey and women, both for Turkey and Jordan, we found that women make up the majority of frontline essential workers, despite their limited presence. So that was an interesting finding, particularly for the case of Jordan. So one of the primary impact for women in Turkey, labor market impact for women in Turkey, as well as in Jordan, is that as being overrepresented among the essential workers, they're facing health risks, plus intensifying paid work hours, and of course also unpaid work hours, which I will mention in a minute. An interesting finding, which seemed to differ from what we are hearing, for instance, from some of the other countries like the US, is that in both the Turkish and the Jordanian context, women are estimated to face relatively lower risk of employment disruption than men. There are some differing estimates. One study, for instance, for Turkey finds that 35% of women in employment versus 50% of men in employment face the risk of losing their jobs. In a survey where my co-author Emel Memiş and I have been involved, 9% of women and 13% of men reported job loss already due to the pandemic, despite the protection measures that are supposed to last through the end of June. So this relatively lower employment labor market impact for women is driven by two factors. One of them is that what I've already mentioned, there are large gender employment gaps, so women's limited presence in the labor market, plus a very strong gender job segregation, where women's concentration in amongst health workers and retail workers and the so-called frontline essential workers are quite heavy.
Ipek, yes. I just want to interrupt you to let you know you've got 2 minutes left.
Okay, all right. So let me go to the next slide because I want to share, we've done some estimates on the impact of the pandemic measures on unpaid work. In the case of Jordan, we used the previous time use survey and we identified proxy variables that could pick up on the impact of the pandemic. And what we found is that, for instance, school closures could have an impact of up to 4 hours on unpaid work, suspension of market for the services for which we use the proxy variable of household income and domestic worker up to 12 hours, and somebody becoming ill up to around 4 hours. And the impact was quite different from the case of men. Next slide, please. In the case of Turkey, we were lucky because we were actually able to conduct a mini time use survey under pandemic lockdown conditions in early May. So this has been there's been a lot of talk about what is the magnitude of the increase in unpaid work, what is the magnitude of the change in paid work and total work for women in employment versus men, and so on. So we have the numbers, and this is available fresh off the oven as a working paper, but I don't have the time to go over this table, so if we can go please to the next slide. So these are the main findings. The unpaid work gap widens despite the fact that we're observing a substantial increase in men's unpaid work. The paid work gap narrows through a convergence down because there's a substantial decrease in men's paid work. As a result of the two, the total work gap increases where women are performing even more total work than men. And this is particularly the case for women who continue their employment in the workplace or through teleworking or as essential workers. Now, two interesting findings that came from this pandemic time use survey is that the increase in men's unpaid work is substantial by their employment status. So those who switch to telework and decrease their employment hours, we're observing almost a tenfold increase in their unpaid work. So this we interpret it as being change in male behavior is possible in a short time under conditions when their work become flexible and they have access to leave, care leave, and when their employment hours are reduced. So rather than campaigns for cultural change, what we need for instigating a change in male behavior is labor market regulations for work-life balance for men. And a final interesting finding was that what we found is the inequalities in unpaid work amongst women by education and employment narrowed substantially. So there was some talk in the first panel about whether this pandemic presents us with a special moment, a historic moment of transformation. And we say, based on the findings of this time use survey, maybe yes, for appreciation of the importance of women's unpaid and underpaid care work by men in general, and also by women and men of privilege. And my last slide. Yes, we, using all these assessments and findings, we issued a collective feminist statement, a little bit like the UK Women's Budgets Group. We have a network of feminist researchers working on women's labor. The Turkish acronym for it is the KEFA network. And many IAFFE members, such as our ex-president Şemsa Özdağ, Emel Memiş, Yada Yücel, Özge İzdeş, they're all founding members of the KEFA network. We had an extensive document with very concrete policy suggestions to the government. And here what you see is the main headings of that statement. Thank you.
Okay, thank you very much. Could I now ask Magdalena?
Thank you very much. It is a pleasure for me to participate here as I'm a lawyer and not an economist, and the first difference that I don't have a PowerPoint presentation. So I think that it's evident that the pandemic impacted all of us, but not in the same way. It is pushing more people into poverty, but it's already disproportionately impacting those who have been systematically discriminated against along gender, class, race, sexual orientation. In the most unequal region of the world, that is Latin America, the impact is dramatic. According to ECLAC, according to recent estimate, COVID-19 crisis will cause a drop of 5.3% of the GDP in the region. This is an historical drop, and this will imply that 107 million women in the region will be in poverty. In this brief presentation, I would like to argue that, as in the case of other regions, now we are facing a major challenge in the region, that all the achievement, all the progress that women's organizing has achieved in terms of gender equality might be reversed. Why? Because of the crisis, and I will explain that. Women are the majority of frontline responder. 72.8% of all people employed in the health sector in Latin America are women. However, due to occupational segregation, they're overrepresented in the low level of healthcare responder. So there are the nurses, the community volunteer, the social workers. Confinement measures are also threatening the life and the security of women. There's been an increasing case, as in the other region, there has been an increase in domestic violence cases, and the amount of time that women alone are alone with their abusers while reducing their possibility to seeking help are really increasing this, and some government has been minimizing the impact. That is the case, for example, of Mexico, where the president came out and said that most of the calls are false. The pandemic has also made evident that just social organization of care and how insufficient have been the modest progress achieved in recognizing, reducing, and redistributing unpaid care and domestic work in the region. To understand the urgency of this moment, I think that we need to go a little bit back to show that during the first decade of the 21st century, around 2002, 2014, there was a period of prosperity in the region. There was social progress, there was democratic deepening, in a context of economic growth and rising commodity prices. Many governments, they were very progressive and increased public spending on health, education, and social protection. And in general, women benefited from those measures. Women in this period of time, at the beginning, at the beginning of 2000 to 2012, I said, women remarkably increased their participation in their labor market. Women also had greater access to social protection through conditional cash transfer, significant expansion on non-contributory pension, Bolivia, Ecuador, Mexico, important reforms in the pension system to recognize the reproductive role of women, for example, in Chile. However, despite this positive progress during this bonanza period of time, women did not benefit equally than men. So in Latin America, during this period, 2002-2012, poverty decreased by nearly 16 percentage points. However, the feminization of poverty increased. The percentage of women aged 20 to 59 living in poor households compared to the proportion of men in the same age range increased by 11 points. That means that if in time of prosperity and bonanza, with the right political context, we did not sort of really make progress in gender equality, what to expect now? The region entered COVID crisis after 7 years of very low growth rate, low commodity prices, protectionism, political instability in several countries, Bolivia, Nicaragua, Venezuela, complete distrust in the political institution, let's say Brazil, El Salvador, increasing violence, for example, Mexico, massive social unrest, like in Chile, that was responded with massive violation of rights and even more shrinking of the democratic space. We have an increase of populist leader, Mexico, Brazil, for example. We have also an increase of misinformation through false social media accounts. This has been recorded in the region. And this is quite dramatic in a region in which we don't have pluralism in the media. Most of the media are from the same corporation in the region. So, and of course, there's been an exacerbation of the climate crisis and other problems in the region. So what are we threatening now? What are the major problems that we're facing? First, a reverse in progress making women access to the labor force, to the concentration in the most, women have been concentrated in the sectors that have been more affected: social services, wholesale and retail sales, business services, and transportation, storage, and communication. These four sectors account for 78% of all employed women in the region, in addition to the fact that quarantine and public health measures will also have an adverse effect on the informal market and small business, where women are also overrepresented. We also have an increase in precarious working conditions for domestic workers. In this region, 18 million women work as domestic workers, and they have been completely abandoned by the state and also by their former employers. Most of them, in many countries of the region, like in Mexico, they are completely in the formal sector. They are not protected and they don't have any benefit. The confinement and quarantine measures has also deepening the crisis of care in the region. Before the health crisis, women from the region dedicated a third of their time to domestic work and unpaid care. But of course, the limited access to healthcare has increased this amount of work, but also the fact that the school closure in the region has also provided more work for women. Due to patriarchal family relationship in the region, there's been an extra burden of unpaid care work. There is also a threat to the feminist mobilization. Before the crisis started, we saw this awakening of feminist movement in the region, led by Argentina. We saw women's on the street that was replicated 8th of March this year. As COVID arrived here a little bit later, it was massive mobilization on the region. But now what is going to happen with this? It is very worrisome. In sum, the pandemic will cause an increase in poverty, extreme poverty, and inequality in the region. But the main challenge is that it's threatening to reverse many of the gains that women have achieved in the last year. I have 1 more minute, so I will be very brief. Again, this background, women's rights and economic empowerment.
You've got 2 more minutes.
Okay, must be placed at the center of the public agenda in order for the region to build economies that are not only more prosperous and resilient, but also more equitable. To avoid the crisis to exacerbating gender impact, we are also seeing some opportunities. So I'm going to try to end it with a positive side. There is an opportunity to move toward basic income. So many countries in the region since March 13 has been announcing social protection measures. According to ECLAC, today 126 social protection measures have been implemented in 29 countries in the region. So these are immediate and temporary assistance that should be unconditional, but this might be the starting point for basic income in the region, finally push for basic income. There is also an opportunity to be pushing for more gender equality in taxation policies, policy choices to raise and redistribute revenues must have an explicit gender approach. I'm not going to go into detail, but let me finalize with this. How we ensure this shift is permanent. There's been also an increase, and the positive side of this terrible pandemic is this enthusiastic support for public services. But how we can take advantage of that, how we can ensure that this shift is permanent, and how to build more equal society. I think that there is an opportunity for progressive change and reform that could ultimately reduce inequalities and diminish the gender gap. I think that the basic way to go there, it is really to have a cross movement, to work collectively. And I see this and breaking discipline silos or organizational silos. So I take the fact that a lawyer has been invited to this economist meeting as a very good sign that we need to work together to take this opportunity that the terrible pandemic is providing us. Thank you very much.
Thank you very much. And now I'd like to ask Ashwini for her presentation.
Thank you, Naila. Thank you for inviting me to this very important panel. And it's amazing, actually, despite so many differences between our contexts, all the 3 previous speakers, the issues that they raised and the evidence they presented could just well have been from India. So it's amazing how much similarity there is in terms of the effect of the pandemic. And the Turkish story actually gives me a lot of hope, because as my work with Naila shows, this persistence of women's responsibility for domestic chores. And if the pandemic could shift that inequality a little bit in India, that would be amazing. So we'll see what the evidence is on that one. Could I have my slide, please? What I'm going to do in today's presentation is present some new work, very recent work, which is actually still work in progress, about the trends in employment and unemployment rates in India and the immediate effect of the pandemic. So here is the data set that takes monthly estimates of employment and unemployment rates. And if you see this particular graph, you'll notice this is from, oh, what happened? This should be from January 2016 to April 2014. Excel has decided to change the dates for some reason. So anyway, ignore what's showing up here. This should be January 2016, and this should be April 2020, and this is March 2020. And what these lines show you is that there has been monthly fluctuation in employment and unemployment rates, But it's basically in March 2020 and April 2020 that employment rates, both rural and urban, have sharply fallen and unemployment rates have sharply risen. This is overall aggregate for the entire population. Next slide, please. Now, on actually the 25th of March this year, India imposed one of the strictest lockdowns as a pandemic control measure. Now, it was a lockdown for the entire population, and in that sense, it was a measure that was completely gender blind. It was lockdown in equal measure for everybody. But as we've seen in the previous presentations as well, that the impact of the lockdown has not been gender neutral at all. So it's been gender blind, but not gender neutral. Now, globally, some evidence has been coming out in terms of the expected unemployment of men and women. For example, there was a recent Citibank report which said that of the 44 million workers in vulnerable jobs, 30 who might lose their jobs, 31 million might be women. So the estimate seems to suggest that in absolute terms, more women will lose employment than men. And this is still ongoing. We still don't know the results of that, but that seems to be the global evidence. Next slide, please. Now, in India, one of the contexts that we have to keep in mind when we look at the gendered impacts is that first, female labor force participation rates in India have been stubbornly low and in fact have registered a decline. Now, there's a debate about whether this decline represents a voluntary withdrawal of women from the labor force, or is it a decline in the ways in which work is available, that not enough work is available? Is it a decline that is coming because of the way women's work is measured? I don't have time to go into that right now unless some questions come up. But the simple point from this picture is that gender gaps in employment and labor force participation rates in India were already high before the pandemic hit. So if you just look at a comparison of just absolute numbers, you will see in this graph, for example, that the decline, more men were employed before the lockdown, and in absolute terms, more men lost employment after the lockdown. So first, the lockdown resulted in a loss of jobs for everybody. And in absolute terms, the loss was greater for men. But if you juxtapose this with the fact that there were already substantial gender gaps in labor force participation rate, if you want to now look at the gendered impact of the lockdown, we have to look at some other statistics. Next slide, please. So one thing that we could do easily is, based upon the numbers that I showed you in the first graph, you can look at the total number of people employed in different categories in April 2020, and look at the average number of people employed in the 1 year prior to April 2020. So you look at the average between March 2019 and March 2020. That reason you take an yearly average is to get rid of the seasonal fluctuation. Otherwise, you could even just compare it to March or February of the same year, but I've just taken an average. And what you can do is you can take a simple ratio, which is April 2020 employment, as a ratio of the average for the previous years. Okay. Now that's what I've plotted for different categories of social groups in India. The middle line in red is the all India line, right? So this ratio was about 0.68 for all India, which means that about 32%, there's been a 32% drop in employment, which is what we actually see. Now, focus on the green lines now. Just above the red line is male here, and just right below here is female. So that means that if you look at the April 2020 employment and compare it to the previous year's average, women have relatively lost much more than men, okay? And within women, rural women, which is the bottommost line, rural women have suffered the most loss of employment relative to their previous level, okay? I have many such classifications. I've just shown you some major ones. You can look at caste groups. Now here, this line in maroon right here says upper caste. These are caste groups that are conventionally regarded as at the top of the socioeconomic hierarchy. These are the privileged caste groups. And this is word SC refers to scheduled caste or Dalits. These are extremely marginalized, stigmatized communities at the bottom of the caste ranking. And you see the relative loss in employment between upper castes and between Dalits or scheduled castes, right? I can do it by rural, urban, I can do it in many different ways. And again, you see here, rural Dalits. So rural women and rural Dalits, rural lower caste individuals have the relative loss of employment has been the highest for these two categories of workers. Next slide, please. Okay. Now, this is just an aggregate picture. My paper, actually, I'm not presenting all the results here, but what my paper does is in using the same data source, this data source is a panel data source, which means that it follows the same set of individuals over time. So this date, there is nationally representative data for the month of April 2020, which was fully under lockdown, right? And so that's more than 37,000 individuals. Now, I looked at their employment status the last time they were interviewed, they were surveyed by this data, which was in December 2019. And if you compare April 2020 with December 2019, it's the same set of individuals that are being compared now pre-lockdown and post-lockdown. So there are, so the earlier figures were just averages, and you could say, well, averages conceal a lot of heterogeneity within categories, but here it's literally the same set of individuals. So that individual level heterogeneity is taken care of. Now,
Ashwini, you have about 2 minutes left.
Yes, this is pretty much my last slide. So if I compare, so basically people who were employed in December 2019 were the ones who were likely to be employed, more likely to be employed in April 2020. So if you didn't have a job in December, it's highly unlikely that you got a job in April. But women who were employed pre-lockdown were 23.5 percentage points less likely to be employed in April 2020 relative to men who were employed pre-lockdown. Similarly, male heads of household were 11.3 percentage points more likely to be employed relative to female heads of household in the same time period. Caste differences, the absolute magnitudes are smaller, but again, relatively speaking, lower ranked caste groups were less likely to be employed in April 2020, conditional on being employed in December 2019. My last slide, please. Others have talked about frontline workers. In India, there's a category of frontline workers that's exclusively female. It's not majority female, it's exclusively female. And I've talked about this group elsewhere. Maybe I'll skip the details of the slide, but basically everything that other speakers have talked about frontline workers is equally applicable to this group of frontline workers here as well. And my last slide. Yes. Now, why does all this matter? First, because as we saw just from this limited evidence, that being gender blind is not being gender neutral. A gender blind lockdown had severe gender defects in terms of employment. Second, as we are seeing it unfold, we are in this for the long haul, and women's livelihoods and lives can't be put on hold until the pandemic is going to be taken care of. It's going to take a while for that to happen. The first step in making sure that women don't disproportionately suffer is the availability of gender disaggregated data. Unless we know the gender differences and caste differences in terms of the impact of the pandemic and employment, we are not going to be able to have a suitable, an appropriate policy response. And finally, again, I can talk about this in greater detail, but a simple point is that ignoring the gender dimension or ignoring the caste dimension is only going to slow down the fight against COVID. So even if somebody hypothetically didn't care about gender equality, but they cared about fighting COVID, you still have to pay attention to the gender dimension. Thank you.
Thank you very much. I think we've been given quite a lot of very interesting and fascinating information. I'm going to make a couple of points and then I'm going to throw it open to our audience. A couple of points that struck me is, the point that Ashwini made about some of the similarities and what that tells us about the way that labor markets are segmented across the world and the gender segmentation. another point I thought when Abena was talking about the different ways in which the Ghanaian government is trying to respond with the best of intentions, but somehow the substance of the responses are biased, biased around class and gender. And that brings up Magdalena's argument about universal basic income. That perhaps that is the one initiative that isn't biased. Everybody could use money, even if everybody doesn't have access to water and electricity and so on. And I really like the way that, I thought Ashwini's ending point, we cannot slow down COVID without taking gender seriously. And Ipek's point about, are we going to see a transformation? That's going to be great if we see greater appreciation of unpaid work. And I hope we get to see Ipek's working paper. But even within unpaid work, there are some distinctions between the more enjoyable aspects of unpaid work, looking after the kids, and the less enjoyable aspects of unpaid work, doing the washing up. So at some stage, we might want to disaggregate, what the gender division of unpaid work looks like and who gets to do the enjoyable parts. Okay, so I'd like to open up, and the format is going to be, we want whoever's speaking to take about a maximum of 2 minutes. You can either raise your hand by clicking on participant and then clicking on raise your hand, or you can use the chat function, and Jihi will be watching out for that. She will be taking about 3 comments at a time, and at the end of each 3 comments, I will call on the panelists to respond. And of course, I'll ask the panelists to also be fairly economical in their responses so that we maximize participation and discussion. So, okay, we can open up for discussion.
Thanks, Jihi here. While we're waiting for questions to come in, I just wanted to ask one from somebody who had to leave early. Actually, we got a few questions specifically for Ipek about the source of your paper and if you were able to conduct a time use survey during lockdown. So maybe we can begin with that while we're waiting for additional questions.
And maybe she can answer.
Yes, Ipek, I think you have to unmute yourself.
Yes, can you hear me?
Yes.
Okay. Okay, the paper, actually the working paper is still work in progress, but we are, Emel and I are the co-authors of the paper, Emel, Memiş and I, and we will be preparing a short policy brief for the UNDP country office in Turkey, because they were the ones who actually supported us to have this collaboration with the polling company to integrate this time use question into their survey. And we will make sure to share it with the IAFFE network as soon as it is ready. And we have a deadline of end of June, so it should be coming your way pretty soon. And then the working paper will be available also, we hope, during the summer. What was the, was there another question?
The time use survey.
Yeah, the time use survey. Yes, it was conducted under containment conditions, under lockdown conditions. The Conda company works, they've been running these regular monthly surveys, which includes a set of questions on political and social attitudes, lifestyles, as well as, a whole set of demographic information on age, education, family structure, employment status, and so on. They've been conducting this on a periodic basis, monthly basis, ever since 2010. There's a previous episode, but then the data is not comparable. Every month, there's a set of rotating questions which change according to the emerging public agenda item, public discussion item of that month. So we were lucky because they had already integrated a time use question based on the recall method in their April 2018 survey. So once we found out about that, we asked them if they could integrate it into their May 2020 survey. So they've been working with these surveyors that are located throughout Turkey. So what they've done is under the pandemic conditions, people were allowed to go around in their own neighborhood without taking transport vehicles to go to the bakery and so on. So they used that space in order to use their surveyors to go and conduct the survey under lockdown conditions. And they did that each month, March, April, and May. And they've compared the results on their standard set of questions to their earlier findings, and the sampling seems pretty consistent. So they argue their results are trustworthy.
So I think we're going to take a couple of questions now.
Yes, first question will be from Prarthna. I'm going to ask you to unmute yourself, Prarthna, and go ahead.
Yeah, hi, my name is Prarthna, and I'm assistant professor with Indraprastha University in New Delhi. Thank you, presenters, for the great insights. My question is around domestic violence, the rise in domestic violence, which we are seeing across the globe, and especially if I look at statistics from India. Now, we know that India has been a patriarchal country, and a lot of this could be attributed to the cultural aspects as well. But if you would want to attribute this to the economic aspects during the COVID times, what are the 2 or 3 main economic reasons we could pin down around that? And the second thing is my request to Ashwini. If Ashwini, your working paper is somehow available, I would really love to have a look at it. Yeah, thank you so much.
Okay, thank you. The next question.
Next will be from Renata. Renata, if you can unmute yourself and go ahead.
Thank you. Hi, everyone, and thanks for organizing this, Naila and everybody else. Good to see you virtually. My question is for Abena, Oduro. Abena, thanks so much for your presentation. I think you made points really stark and clear. So my question is on following up recommendations. So if subsidies for electricity or measures for education, etc., are unequal because of the underlying inequities that exist, if a government wanted to address those inequalities now, before addressing the underlying structural inequalities, what could be a way to fulfill the needs of people with low-income households and women that have no access to piped water, no access to electricity, etc. I'm thinking whether, as Naila said, a basic income transfer is really the only low-hanging fruit to really address some of the economic inequities we have, or there's been discussion of other possible interventions that help vulnerable people in those specific sectors that you emphasize, like education and access to utilities. Thank you so much.
Do we have any other questions, G?
Yes, I'll add one more to this round, and then we have a few after that. So next will be from Carmen. Carmen, you can go ahead.
La, la, la, la.
Carmen?
Hello, hi, I'm sorry, you took me by surprise. Hi, this is Carmen Niethammer, and I was very interested to hear more about the interventions that central banks have been undertaking. Obviously, the situation in Ghana was not ideal, but do we have any best practices that maybe even the contributors from other countries can share with us?
Okay. So there are a couple of questions addressed to specific people. So I'll ask Ashwini and then Abena, and then open up to the rest of the panel as well. So Ashwini, I think the question was really about your paper, wasn't it?
Yeah.
So it wasn't really a question. Okay. So the question to Abena.
Okay, thank you. In terms of what else could government have done? You find that in Ghana, we have a high labor force participation rate for women and also for men. And currently, government has a small, a soft loan scheme for small and micro businesses. And thinking as I was putting this together and thinking about it, I was thinking to myself, maybe the money is about 200 million or 300 million that government was spending on the subsidies, they could probably have pumped into the soft loans and maybe consider making the eligibility criteria such that more women would be able to apply. So that was one possible option that I had been thinking about. And the second is that we do have a social assistance program where government every other month gives sum of money to vulnerable households, orphans, and people with disability. So this is also another route that government could have used to be able to identify and help poor households. Right now, the coverage is rather limited in terms of the LEAP. So again, it's pointing to the issue that was raised by one of the colleague presenters, that we need more data to help us identify the vulnerable, making it possible for government, if given limited resources, to target better. So these are the two possible options that I think government could have considered.
Okay, then there's a general question to the panel about whether there are economic reasons for the rise in domestic violence during this pandemic. And I wanted to add a question to, not so much to Abena, but picking up what Magdalena had said around the basic income business and what Ipek had said about investment in health, and how important that had been. And I wondered if Magdalena could also address, on top of basic income, which is like the minimum, whether we should not also be arguing for essential services, basic essential services like health. I mean, I think that's something the pandemic has taught us. So I'll take it in turn, and let me start then with Magdalena on both the domestic violence question, but also if you could think a bit more about this, what the government can do. You're unmute.
Oh, just 1 second, apologies.
Yes.
Thank you.
Go ahead.
Thank you. About domestic violence, I think that the links with the economic question, it's very clear. I'm going to give you an example here from here in Mexico. So the government of Mexico, when it started implementing austerity measure, the Republican austerity it is called here, and among those measures, he cut down the money going to all houses for women's survival of domestic violence. That money was cut out. There was also he cut the money going to all the civil society organization protecting women's survivor of domestic violence. Therefore, what happened was that when the COVID and the confinement measures came in and the lockdown came in, we have a situation in which most women do not have an independent income by themselves, so they don't have any resource to go outside their house. They don't have any public support or any public measure where to go. So they're completely helpless in terms of having to stay with the abuser in their house. So I think that these are basic issues and they're all connected, and we have been seeing here. About essential services, I also think that this is critical. I think that, and again, I don't know how, but there is this, the public is back. There is this increased attention to the need to have universal access to healthcare. And the question for me is how we take advantage of this attention. We have now citizens that are more prepared to hear the arguments and push forward for the argument, but it's not an easy response. Of course, many countries in the global south are going to have problems in terms of their resources because of the crisis. But definitely the major inequalities that we have seen is in access to tests, access to healthcare, and the impact that required. But there is an opportunity. For example, even a right-wing country government like in Chile was able to put a certain public measure over private profits. So they have been able to take ventilators, for example, from private clinic to move it to public clinics, et cetera, et cetera. There is an opportunity. How we take it,
okay.
I don't have that answer.
Thank you. Can I ask Ashwini to take the domestic violence question as well?
Yeah, so in India, just like in other parts of the world, there's been a spike in calls to helplines after the lockdown was imposed. And there's a whole range of reasons, including the fact that the abuser is feeling frustrated at his lack of control over the outside situation. And he has full power because the people that he's abusing, his partners and his children, are locked in, because of the very strict lockdown. And so one of the things, I've written about it in journalistic pieces, one of the things which eventually the Indian government did, which is to declare shelter homes, services that can provide assistance to women who are being abused as essential services. So eventually that did happen. But yeah, but it's more complicated than that. It's not only an economic reason that because of which domestic violence happens.
Ipek, do you want to take the domestic violence question?
Yes. Well, the feminist approach to domestic violence is that, at the source, what lies is the hierarchical gender relations. So it is not alcohol or drugs or unemployment or what have you, all these things per se that lie at the source of domestic violence or violence against women. But it's they may be triggers, but what lies at the source is the hierarchical power relations that exist between women and men. And yes, of course, as the other speakers have said, the income gaps or the inequalities in access to own income is an important source of these gender hierarchies and the dependencies. So in the case of Turkey, as it was on my last slide, while our feminist collective statement focused on by the KEFA initiative, focused particularly on economic issues, actually when you look at the women's organizations, generally speaking in Turkey, the main agenda item starting in March when the lockdown conditions were imposed was actually violence against women. So there were many campaigns, there were many statements that were widely signed and sent to the government. And particularly with the release of prisoners under the COVID measures in an attempt to empty some of the prisons, a major category was actually people who were imprisoned on charges of rape and abuse, and they were amongst the category of people to be released. And immediately following that, we had a number of incidents around the country of killings and abuse. So yeah, that was definitely one of the burning issues in Turkey as well.
Thank you. Abena?
I don't know that I have too much more to add.
Okay, good. G, could we take the next 3 questions?
Yes, the next question will be coming from Melissa Upreti. Melissa, you can go ahead and unmute yourself.
Thank you. Hi, everyone. My name is Melissa Upreti. I'm with the Center for Women's Global Leadership. Thank you so much for all the presentations and insights. One of you mentioned the idea of breaking silos and working together. And I'd like to hear a bit more about how you see that happening. What are some of the things that we can be doing now? People working in different fields. I'm a human rights lawyer. How can we work with economists and others to bring about some of the, transformative systemic changes that we need to see? How can we seize the opportunity that we have now? Thank you.
Okay, next question.
Yes, next will be Elizabeth Villa-Gomez. Elizabeth, please go ahead.
Hello, good morning, everybody. Very happy to see all these wonderful speakers and learning from them as we always do. I just wanted to comment something that's to keep it in your radar. I'm seeing that there are many initiatives by CSOs, mostly supported by the UN system, but others with other monies, monitoring the cash transfers. And it will be interesting to see how the CSOs are monitoring these cash transfers, but also just the gender perspective. ILO is, of course, in there trying, but it's not always automatic that they take into account gender in putting together these cash transfers, especially right now. That at least that's what I'm seeing, and just to flag it for you as something that you might want to look at in the research that you're doing. Thank you.
Thank you. And is there a third? And that sounds like a general question, right? Is there a third question?
Yes, there is. I'm going to read this one on behalf of Ida Akara, who asks, I'm wondering how different women's groups, feminist initiatives, and trade unions and other relevant movements, other than the governments, do respond to gender impacts of the lockdown? And are there just practices, unlike best practices, on the ground to actually bring forth or ease women's burden in a lockdown?
Okay, thank you. I think those are all quite general questions. So I'll just take it in the order that people started to speak. So let me start with Abena. Would you like to answer either one of those questions or both? Breaking silos, CSO monitoring, and just practices by trade unions. Don't feel obliged to answer all three, because you might be here forever. But is there any one or two of those that really speak to you?
I'll answer one that I'm more comfortable with. And this is in response to the first question, how can we work together? And I'm director of the Marion Institute for Advanced Studies in Africa. It's a new institute at the University of Ghana. And the focus is on interdisciplinary work. So what it is we have teams of researchers coming together, working on a particular topic. So we can have researchers from sociology, from history, from geography, anthropology, working together on a particular topic. It's possible to also have them, depending upon what the topic is, from the sciences. So I would propose that as one way of trying to get across from the silos. The recent group had sociologists and economists, and it was interesting, the different perspectives of the sociologists and the economists on the issue of rural transformation.
Okay. Ipek? Do you want to take any of those questions?
Yes. Actually, Naila, there was something that you mentioned and Magdalena mentioned about basic income. So if you will allow me,
Sure.
I think it's a very important issue that's also out on the table in Turkish policy discussions, not by the government, but by civil society groups and
Ipek, could you combine your answer with the one about monitoring cash transfers? So if we're,
monitoring cash transfers.
Yeah. So, since basic income is a cash transfer.
Yes. Well, the argument, actually, the argument for basic income in Turkey was proposed by the opposition, initially by the opposition Social Democratic Party initially, because they were pointing out how cash transfers actually has been used by the incumbent government as a political populist tool to get votes. And that the criteria is not clear and its implementation is not monitored. And by the way, the cash transfers have expanded enormously in the past 10 years under, almost 20 years under Erdogan's rule. The idea here is that a basic income implementation actually would acknowledge the access to a basic level of income as a citizen's right, and also make us free of the responsibility of monitoring cash transfers, right? So that would be a solution so that it would be like hitting two birds with one stone. My positioning, or I would like to point out something about the basic income discussion. I think, Naila, what you said about the dual policy intervention of basic income simultaneously with access to services is incredibly important, because otherwise an implementation of basic income by itself definitely very strongly carries the danger of reinforcing gender roles and women's positioning within the domestic sphere, and the dominance of the public sphere by men and decision-making by men. So I think that's a very, very important component of the discussion. And as feminists, I think our slogan has to be no basic income without access to social care services, right? Because that implementation by itself is likely to lead in the direction of the dystopia by Margaret Atwood on the Handmaid's Tale, something along those lines, where women's positioning in the reproductive sphere becomes institutionalized through economic, social policy. But I would like to add a third thing, a third component to it: also access to the option of decent employment. And reminding of the role of the state as employer of for providing full employment, and the possibility of the possible role of the public as employer of last resort. Okay. And actually, just one example that I want to share: in the Republic of Northern Macedonia, there's a community works program, as they call it, public works program, that's being implemented particularly for provisioning of social care services, which is very special because most of the time community works or public works programs are created, jobs are created in physical infrastructure jobs, environmental jobs. So this one is geared, it's all over Macedonia, conducted by the Ministry of Labor and the municipalities. And the main objective is to create jobs in social care services, childcare, disabled care, disabled childcare, and elderly care services, home-based elderly care services. And most of the employees are women, and there's a skills upgrading component added, and most of the service receivers are also women. And the program has been doing some wonders. So these are, I think, the types of examples that we need to be thinking about as providing a social safety net, rather than just thinking of basic income by itself.
Okay, thanks very much. Magdalena? You can take any one of those questions: silos, basic income, monitoring, just practices.
I will
not all of them.
No, I will be very brief. I fully agree with Ipek in terms of the nuances that she made regarding basic income. I also agree with Abena on the examples of interdisciplinary work. And I'm just going to add that the scale of the common challenge that we have, it's really, I think that we have no option but to build collective power to tackle the systemic injustice that we're being facing from free market fundamentalism, corporate capture, patriarchy, and also institutionalized racism. So I just wanted to, for the question from the colleague for the Center for Women Global Leadership, I think that working between academics, economists, lawyers, civil society, human rights organizations, together with feminist organizations, and trade union, etc., is the way forward. And I'm going to leave it there.
Thanks very much. And Ashwini, any one of those?
Just a couple of points. One of the things that we saw in India during the lockdown was that because of the distress, cash and kind transfers were both needed. And the government announced a very paltry sum of 500 rupees, which is really nothing, into the accounts of women only who held these particular types of bank accounts. Now, here was an example of a gender-targeted measure. But the problem is that the banks are located very far away from the villages where the women live. And so how are the women even going to get to the banks in order to get that paltry amount that was promised. So sometimes when the measure is even on paper a welcome measure, we are blind to the structural barriers that prevent women from accessing, for example, the banking system, right? And so if we even the recognition of these structural barriers is should be a very important component of any kind of program implementation. Even so, one is, of course, you shouldn't be gender blind, but even when it's gender targeted, there are stories of women not being able to access even that small, tiny amount of money that was promised to them.
Yeah, okay, we're coming to the end of our time, but we do have a couple more questions. So we'll ask the questions to be brief and the responses to be brief.
Yes, I'm going to read the next question on behalf of Gökçek from Turkey, who's currently preparing dinner because it's dinner time in Turkey, and asks, in the process of social isolation, socialization, and politicization of personal experience is interrupted. Considering the fact that politicization of personal experience is the main source of women's liberation and emancipation from patriarchal power, is it expected that the norms envisaged by the public power that is organized around the patriarchal gender relations may strongly reproduce itself? Is there a danger appeared from the fact that social isolation lead authoritarian systems to determine future life? And after that, I'm going to actually call on our final question, which is from Emma. And Emma, you can share that yourself if you unmute.
Hi, thank you very much. This is Emma with the Bretton Woods Project. It's really great to see you all, and thank you for the great presentations. So as some of you know, I work in very neoliberal spaces in advocacy, especially at the IMF. And as you may have seen, they're really using some of the language that's coming out of more grassroots and feminist movements to so-called build back better, including in terms of inequality, they say. And we're trying to make clear to them that to do that, especially for the global South, they would have to, reverse most of their policies, stop austerity, et cetera, and really re-examine their own role in exacerbating this crisis. But as you might imagine, it's not really going down well. And we're really concerned about what's going to happen next year when the emergency financing runs out and a huge new raft of IMF austerity-based programs are going to come in. And so I just want to ask, what advice would you have, especially maybe as economists, on what arguments might break through to them at this point, or more generally, what would you want to see or not see from the IMF right now or institutions like it? Thank you very much.
Okay, that's the last question, isn't it?
Yes.
Yep. Okay. Let me go the other way around and ask Ashwini if she wants to take either or both of those questions, but fairly succinctly.
Well, I'll just make a couple of comments about the last question, which is that austerity was exactly the opposite of what we need today in today's world. It's a crisis of demand. People's incomes have fallen, their employment has fallen, they're unemployed, they can't go and buy stuff. GDP has plummeted in India, it's going to plummet everywhere. What we need is the exact opposite of austerity. And I think the evidence is too strong to ignore. You should do everything in your power to persuade the IMF to not, fall into the austerity trap. The world has suffered, we've suffered a lot in the past because of this very supply side, austerity driven. What we need is an injection of demand. You can give India as an example of that need.
Okay, Magdalena?
Sorry, I don't have nothing to add. I fully agree with Ashwini.
Okay. Ipek?
Yeah, I will add, I will take from where Ashwini has left, actually. I think, yes, that I think there's consensus around the macroeconomic policy circles also, Emma, that, austerity is not the way to go this time. That injection of demand, however, needs to be somewhat differentiated in terms of injection of demand through what means, by what types of allocations. And I think from the perspective of building back better as more resilient, for a more resilient economy and for a more resilient world, investing in social care services, which have the potential of not only relieving people of their caregiving burden, relieving women of the unpaid work burden, but also have the potential to create millions of jobs, as recent research has shown. So the employment creation capacity of social care services is the highest of all the sectors, much higher, about 2.5–3 times more than physical infrastructure or construction sector, for instance, usually where spending goes to, fiscal spending goes to. So, so it is building back better through injection of demand by spending, by increasing spending in social care infrastructure, is not something that's going to only redistribute the unpaid work burden and relieve the time constraints on women's labor supply, but also create labor demand for millions of workers, men and women. As the ILO study, the 2018 ILO study, which has a simulation, a global simulation, I think is a good, provides some good evidence for this.
Thank you. Abena?
Yes, to add on and to say, first of all, that the COVID-19 is an external shock. And so there is a need indeed for soft loans, or concessional lending. So this is something the IMF needs to consider. And indeed, yes, I support what the other speakers have said about the need for an injection in demand. And this indeed is what the government of Ghana is doing. Its fiscal deficit is expected to rise to 9.5%. There was a question before about monetary policy. And you find that in the case of Ghana, not only have we gone into our wealth fund to get financing, but we have also borrowed, changed the Bank of Ghana Act to be able to borrow from the central bank to help government to finance the deficit. And then in terms of where should the spending go, based on the case of Ghana, if we are looking ahead, basic services, electricity and water and housing. Thank you.
Okay, thanks very much. I think the other challenge for the IMF and all of us is about revenue mobilization. And therefore, I find, we really have to rethink the taxation system. And on a very small example, Scotland is taking a stand against firms that resort to tax havens. The amount of money that disappears from our economies because of tax havens is something I think this, because all of this spending at the moment, that's going on is going to have to be paid for, but it should not have to be paid for by the poor. So we've come to the end. I'm going to very quickly answer a question which someone asked privately. They didn't want to name themselves, but it was addressed to me. And it was asking me for the distinction between enjoyable and not so enjoyable unpaid care work, because I made that distinction. So I want to say that, a lot of people like playing with their children, and they like taking their children to school, and they may even like to do the shopping. What they don't want to do is clean the floor, wash the dishes. There's a saying in Britain, there was a saying in Britain called the toilet roll fairy. Who changes the toilet rolls? So, there are certain routine, boring, dirty jobs that are not that enjoyable. But playing with your kids is unpaid care work. But most people would do it very freely without pay. So that's really what I meant. So let me just conclude by saying this has been a great panel, a very, informed and rich discussion. And I want to let you know that there will be a recording that IAFFE will be providing an email with the recording as well as information about future events. And as James said at the very beginning, the next event at the same time will be on June the 19th, and it will be focusing on racialized and marginalized communities in the time of COVID. So goodbye, everyone. Thank you, everyone. And do whatever you have to do. Bye-bye.
Thank you. Bye.
Thanks, Naila.